The future of social work is up in the air in Ohio. An amendment has been proposed to House Bill 509 that would allow for people with degrees other than social work to become licensed social workers. First News Weekend morning anchor Samantha Bender is live in the studio with reaction from professionals in the field. Sam.
Good evening. The social work professionals I spoke with today tell me this proposed amendment is a public protection issue, as it would allow people with a related degree to be able to apply to be a licensed social worker, eroding the field's professional standing and reputation. Take a listen. As House Bill 509 states now, to be eligible for a license as an independent social worker, an individual must hold a master's degree in social work, complete at least 2 years of post-master's degree social work experience supervised by an independent social worker, and pass an exam administered by the board. But if the amendment to House Bill 509 is adopted, and if the bill is passed by the Senate in Columbus, some of those requirements would change, allowing individuals with a related degree to have the ability to apply to become licensed social workers. Danielle Smith is with the Ohio chapter of the National Association of Social Workers.
Folks should be able to trust that when they're working with a social worker, that person actually has the degree, the experience, and the training to be a social worker.
In Ohio, a licensed social worker can diagnose and assess mental health disorders under supervision.
This could mean that we have people who have a background outside of mental health having the licensure scope to be able to diagnose a mental health disorder.
Dana Davis, an associate professor in YSU's social work department, tells me she's sure the legislators had good intentions behind the proposed amendment and says it's likely to address the workforce shortage, but
they're missing a lot of pieces. This is not going to be the solution.
Although there are professions that are similar, like counseling, psychology, sociology, social work is unique, and I worry that this is a slippery slope to us losing the specific way that we practice.
Smith says she's talked with several students who all have voiced similar concerns.
Well, why did I enter this program and pay all this money and spend all this time to get a master's degree so I could be a licensed social worker when I could have just gotten a license with my bachelor's degree in my related field?
The committee will hold a hearing on the bill tomorrow at 3 p.m. I reached out to 2 of the state reps who sponsored the bill to gather their rationale behind the proposed amendment, but did not hear back before my deadline. In the meantime, Smith encourages people to contact members of the Senate Workforce and Higher Education Committee with their concerns, because while she agrees there's a need for more social workers, she believes they need more time to figure out how to address the workforce issue. Live in the studio, Samantha Bender, WKBN 27, First News.